Hi guys, I'm here with Dr. Josh Livingston, and we're going to talk about addiction. So I know that in our past feeds, Doctor, we've addressed things like depression and ketamine, but why don't you kick us off with talking about addiction and what that really is and what are some things that can help?
Sure. So we're seeing a really high rate of substance use, abuse, and addiction at this point, higher than probably any time in the past, due to essentially the ongoing stress and anxiety related to the pandemic and the social isolation. Many stories of former addicts who have been clean or sober for quite a while relapsing just due to the increases in, again, stress, anxiety, isolation, depression, all those things that we're seeing. Unfortunately, very high rates of overdose and death, unfortunately, as well, highest in history, 20% increase year over year. So it is a very important topic that is getting really kind of swept under the rug, not really mentioned a lot of. And addiction itself is the process of course, misuse of substances repeatedly with adverse outcomes, whether it be to health, relationships, job status, economic situation. It's really what defines addiction, and then the inability to stop when started. One of the main ones that we treat here, we treat certainly opiate addiction, whether it be heroin or pills, as well as alcohol addiction. And interestingly enough, the ketamine treatment that we mentioned previously for depression has been shown to decrease cravings for all substances as well. So kind of an interesting dual purpose medication there. So pretty interesting stuff.
So explain to the viewers about the addictive brain and kind of how it works differently than a non-addict brain.
Yeah, there's different areas of the brain that are affected through addiction. We think partly through genetics and then through experience, usually as early childhood, but early adulthood and adolescence certainly play a factor as well. And the areas of the brain that are controlling addiction are beyond conscious control. They're the lower centers of the brain that create the cravings and the drug needs. The withdrawal symptoms are something different, but the brain itself in an addict is substantially different than in a non-addicted brain. And it behaves in ways that people who aren't addicted just can't understand without a lot of actual training or at least attempted education. That's why it's pretty easy from the outside world to say, hey, just quit doing that dumb stuff. Just stop doing it. And if you've never had addictive tendencies or any addictive behavior yourself, it's really hard to understand why they can't. And it is not, unfortunately, from the last 50 to 70 years, we've viewed it in the United States at least as essentially a moral failing, just poor choices. And now science and functional MRIs have shown us that it's an area of the brain that is beyond conscious control. So despite the fact that the behaviors look intentional, it's unintentional behavior. It's uncontrollable behavior, much like with schizophrenia, how they aren't choosing to hallucinate, they aren't choosing to have delusions, they just have them. And so in an addicted brain, very similar behaviors, and it's a very similar patterns. So it's something that addictionology and the study of addiction now has changed much in the way of our understanding of addiction.
So one of the things I wanted to ask the doctor is they've recently changed regulations insofar as opiates are concerned. The doctor has informed me that in the last few years, I guess, they've changed the regulations as to how they can prescribe opiates to patients. Doctor, how do you feel like this has contributed or minimized the addiction, overdosing stuff that was happening in this country?
Right. So what's unfortunately happened is there was a recommendation in about 2017 or so that the FDA made about a certain amount of medication that could be written to patients from a primary care office. And then many states, including Oklahoma, where we are, has decided that they're going to make that a law. And so many physicians just completely stopped prescribing opiates altogether because they were concerned that they're doing something illegal, not just against the board's recommendation or any other way, but truly illegal, that they could be arrested. And others then limited supply of medications to many patients. And what it's done, unfortunately, is driven more addicted patients to using more problematic substances like heroin, often fentanyl, many things that have led to a dramatic increase in overdoses and overdose deaths. Despite the availability of prescriptions dropping 40% since their peak, addiction and overdoses have more than doubled in that period of time as well, with the admissions to rehab going up substantially as well. So it shows that limiting the supply of prescription opiates did very little, if not nothing, positive, and probably caused more deaths due to a reliance more on heroin.
Wow. Well, that is something. And as the doctor and I go through these series with you all, We want to let you know that he does have some treatment options, which is why the ketamine videos came prior to this one. Please tune in our next series as we discuss healthy habits to overcoming things such as addiction and depression. You guys have a great day. Bye-bye.